Hello everyone, my name is Melissa Dukish and I'm a physician assistant here at Hartford Healthcare GoHealth Urgent Care, and I'm here to talk to you today about the 5 things you need to know about UTIs. Every day in the urgent care we see people with urinary symptoms and we are able to diagnose and treat them. The first thing you need to know about UTIs is that UTI stands for urinary tract infection. This involves anything from the kidney to the bladder. We most frequently see bladder infections in the urgent care. The second thing you need to know about UTIs is that there are 2 types, like I just mentioned, the bladder and then also kidney infections. Risk factors for UTIs include being female, sexual intercourse, recent spermicide use, and history of UTIs. Symptoms of UTIs include strong persistent urge to urinate, burning sensation with urination, passing frequent small amounts of urine, cloudy appearing urine, urine that could appear red or pink, a sign of blood in the urine, strong smell or odor, and pelvic pain in women. Some symptoms or signs that the infection may have spread to your kidney would include fever greater than 100.4 degrees Fahrenheit, chills, mid-back pain, nausea, and vomiting. The third thing you need to know about UTIs is that we can absolutely see them in the urgent care and take care of you and get you feeling better. If you or your family members have symptoms of UTI, you should go to an urgent care straight away or see your primary care provider as soon as possible. Waiting for your symptoms to resolve on their own can lead to a bladder infection spreading to the kidneys. When you come to an urgent care, we'll take a sample of your urine and run a test called the urinalysis. This initial test will check for white blood cells, the cells that kill infection, blood, nitrates, protein, among other things. If this test is consistent with infection and UTI, a UTI, we will start you on antibiotics right away and get you in the process of feeling better. In some situations, we'll send your urine sample out for culture, and what cultures do is they confirm that you do have bacteria in your urine, and also it gives us a list of all the antibiotics that will take care of the infection and all of the antibiotics that there is resistance to and will not work for you. If you do not appear to have an infection, the provider will most likely hold off on the antibiotics and possibly order the culture. Also, if you were diagnosed with a UTI, you will be prescribed an antibiotic. We can also prescribe a medication for the burning and symptomatic treatment. That medication is called pyridium. The fourth thing you have to know about UTIs is that if your test comes back negative and you're still having symptoms, you may have something else going on. Some other things that could cause urinary symptoms include vaginitis and also sexually transmitted diseases. But those will typically have some other symptoms like vaginal discharge, itching and discomfort. And the 5th thing you need to know about UTIs is that some UTIs are more complicated than others. If you have a history of diabetes, if you're pregnant, have urinary obstruction like a kidney stone, have a catheter, kidney transplant, or an immune compromising condition, your UTI will be considered complicated, as these are factors that increase the chances that the antibiotics may not work for you. If your UTI is considered complicated, you'll be put on a specific antibiotic that's a little bit stronger and should take care of your infection. Fortunately, most people we see in the urgent care for UTIs do not end up having to go to the ER, and most are managed in the outpatient setting. This is Melissa Dukish from Hartford Healthcare GoHealth Urgent Care. Thanks for listening.